I want to talk about something really important. At least 10 Indianapolis area hospitals, including Methodist, Eskenazi, St. Vincent, on diversion Monday, all at the same time, meaning they could not take patients. One cardiac patient had to be transported 80 miles from Franklin to Muncie. Dr. David Dunkel is the president and CEO of Johnson Memorial Health and joins us this morning answering questions about why this is happening. Doctor, good morning. Good to see you.
Good morning. Thanks for having me.
Absolutely. People want to know more about this. Diversion happens often, maybe at one or two hospitals, but having 10 at the same time is not normal. Can you let people know, in your opinion, why is this happening now?
I think it's just a bad number of things coming together at once. I think obviously, I think a lot of people put off care during the COVID pandemic have come back to hospitals for that care, which is great. But also I feel that you've seen, Delta variant increasing 80% of cases, more transmissible. People aren't wearing masks anymore. So also we're starting to see an uptick in other respiratory viruses that we haven't seen because people have been mask wearing. But also I think there's a huge nursing shortage. I think a lot of nurses have become burnt out during this pandemic. Again, they never had the opportunity to stay home, working more hours than they've ever worked, more pressure mentally, physically. And a lot of people have left the profession. I think also in a lot of young nurses, there's so much money out there in travel nursing that they've left. So I can tell people that, like at our hospital, there's days we've had to be on diversion. It's not because of lack of beds, it's lack of staff to take care of people in those beds. And I think a lot of other hospitals are facing the same pressures.
Yeah, I want to dive into that a little bit more. I've talked to several ER doctors that said right now, just in kind of a glance, they believe that the COVID patients are really less than about 10% of their population of what is in there. So it's not really, in their mind, it's not filled with COVID patients right now. But again, like you said, that nursing shortage, how do we fix that problem right now? And as far as a CEO, when you're talking about the financial health of the hospital, how do you pay these nurses more, and how are you guys doing, or how is the business overall doing, without giving specifics, dealing with what we're going through right now with the economy?
Yeah, it's tough. I mean, first of all, you want to be sure that the nurses feel appreciated, which we do everything we can to do that. We try to make sure they have enough personal protective equipment. We try not to overwork them, but it's tough. I mean, and again, the prices have gone up. Nursing salaries have gone up. Lots of area hospitals, including ourselves, we're offering bonuses for new nurses. But it's supply and demand, and it's tough because you feel guilty sometimes when you have a nurse come from another hospital, because again, we're all in this together, taking care of patients. And when I know if I have a nurse come from one of the other local hospitals, that's one less nurse that they have. Maybe that's 2 or 3 less beds they can staff. So it's rough out there right now.
Yeah, and I talked to one of my daughter's high school friends. She's going to be a nurse. They're going to be going to college next year. And I just really kind of try to inspire her to really look at that as a career. We only have about 45 seconds left, but what do you tell someone who is thinking about, what they're going to do with their life and just how important this is needed right now, and maybe something they want to think about?
Yeah, there's nothing better than taking care of people and having a positive impact on their life. And obviously nurses are fantastic at that, but it's more than just nursing. I tell you, there's a shortage of respiratory therapists, it's a shortage of ultrasound techs. Healthcare is great, it's rewarding. I would encourage everyone to look into it. We don't have enough physicians, we don't have enough nurses. The population is aging and continues to grow. We need more healthcare workers for sure.
Dr. Dunkel, thank you so much. Again, it's just a few minutes, but we love to get that information out there. Maybe somebody's watching and thinking, you know what, this is a career I'll choose, or maybe someone will come out of retirement and help us out. Good to see you.
Thank you so much for having me.
You're welcome. For more information, to fox59.com/Angela Answers. Zach Myers also did a more in-depth story on this, talking to other folks yesterday. It's at our website as well.